Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
For those of you who have not watched any videos or are locked in a hole, we're in the middle of a pandemic that seems to not be getting a whole lot better right now. There's a hint of hope at least.
Yeah.
But we're not quite there, I'd say.
Nope.
Today's topic is not about the pandemic, refreshingly.
Yeah.
It is about, someone asked this, actually one of the viewers' comments, if I have a sore hip and a sore knee, which one should I get replaced first?
Yeah, I find myself spending quite a bit of time in the office going over this with patients when this situation does arise. So same side, you've got arthritis in your hip and arthritis in your knee on the same side.
Yep.
You know, it's bad enough you've exhausted all non-operative treatment and your surgeon and you have decided that you need a surgical intervention, some form of arthroplasty, a joint replacement. Which one do you tackle first? Do you replace your hip first or do you replace your knee first?
And there's actually some reasons behind the answer. So first of all, what's the answer? If they're exactly equal.
Yeah, I always tell people we always deal with the hip first. We try and replace the hip first. And for me, there's two main reasons for that.
Okay, number one. What's your first reason?
My first reason.
What's your reason?
Oh, yeah, my first reason. My first reason is that if you have a very arthritic hip and a very arthritic knee, and you try and replace the knee first, you will have a difficult time doing the post-operative rehabilitation to get your knee bending. Okay, why is that? Because to bend your knee, you have to bend your hip, all right? And if you can't bend your hip well, then you won't be able to get the range of motion in your knee, and we all know that after knee replacement, knees like to get stiff.
Right, so you're saying, I'm trying to bend my knee as part of my rehab, but I can't do that because it hurts my hip.
That's right.
Okay.
Or my hip won't even go, it won't bend that
Yeah,
way.
if it's like really arthritic.
So you can imagine if you have a bit of a flexion contracture in your hip, you can't really see this, but if your hip stays a little bit flexed, then for your foot to hit the ground, your knee will also be a little bit flexed. Okay?
Yeah, you might not get it straight or bent.
You may never get it straight again, you may never, so because of range of motion issues, I like to do the hip replacement before the knee replacement in cases where you have severe arthritis in the hip and the knee.
Totally agree. So your number two, but also my number two is with an arthritic hip and an arthritic knee, once you replace the arthritic hip, sometimes the knee pain can go away or reduce enough that maybe you don't need a knee replacement imminently.
Yeah.
So I've had it before, and I'm sure you have too, or people come to the office like, oh, I have a sore knee, and you examine the knee and you x-ray the knee and everything looks okay, and you're like, then you examine the hip and you're like, hey, then you get an x-ray of their hip and actually they have severe arthritis of their hip, but because it's the femur that connects the hip to the knee, it can radiate down and cause knee pain. So sometimes your knee pain can improve with a hip replacement.
Exactly, yeah. Funny little thing about the human body, for some reason, some people feel hip pathology in their knee.
Yes.
So like you said, sometimes someone comes in complaining of their knee, you x-ray their knee and it's totally fine, examine the hip, and that's where the pathology is, and it can be arthritis. Now this is another, on an aside, in kids, it's very common for kids to come in complaining of thigh pain or knee pain when the pathology is in their hip.
And a couple really important ones, not that we're going to get into, but that's why we're always taught too to examine the joint above and below to make sure that nothing else is going on.
Yeah, I always, and I teach residents to do this, always check the hip when you're dealing with knee. And it's easy, check, you just flex the hip, internally rotate it, externally rotate it, basically move the hip and see if it hurts when you do that. You're going to be triggered. So yeah, number two reason, yes, sometimes you feel hip pathology in your knee. So when you replace the hip, the knee pain gets better anyways. You might not need to replace your knee.
There you go. Do you have a number three?
No.
I don't really. Maybe because hip replacements are easier, so you won't be afraid of getting the hip done after you have your knee done.
Well, yeah, it's easier to recover from hip replacement than knee replacement. So yeah, you'll never come back after you have your knee replaced, but you might come back after your hip. Yeah, sure. Start with the easy one.
So so the short answer is if both are severely arthritic and equally problematic, we recommend doing the hip first, but obviously you discuss that with your surgeon.
Yeah.
So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.